The pain was unbelievably severe. I would wake up sometimes or just be laying on my back and tears would form in my eyes. Not only was there an incredible amount of pain, but anytime I would turn my head either to the left or to the right, my arms would fall to their sides. There was a numbness and I wasn't able to use my arms. Day to day, you find that it just wears you down. It's like you're a stone in the ocean being worn away by the waves. As it continues to hit you every single day, you just feel less and less motivated and less inclined to do anything that resembles your everyday life. I had seen several neurosurgeons prior to going to the Michigan Head and Spine Institute, and I was either diagnosed improperly or some neurosurgeons really didn't give me any diagnosis at all. Initially saw Dr. Farhat at the Michigan Head and Spine Institute.
When Jeff initially came to see me, he was having a lot of pain. It was diffuse pain involving his back, mid-back, low back. His goal was ultimately to come off of pain medication and become more functional. When I reviewed the studies he brought in with him that day, his symptoms didn't seem to correlate. I decided to order further imaging, which included an MRI of his neck. The brightness on either side is normal. That's what we would like to see. That means the spinal cord has plenty of room. When I looked at Jeff's MRI, you can notice that brightness that was on either side of the other spine is not there for Jeff's spine. This is a combination of factors. One is a congenital factor, meaning he was born with a smaller spinal canal than the average person. On top of that, he had degenerative changes of these discs that, in combination with his congenital issue, has caused a significant narrowing of his spinal canal. Now, the concern in the neck is there's spinal cord that controls our neurological function, from motor movement to bowel function, everything that makes us functional. I became concerned and brought in my colleague, Dr. Veyna, to review his case.
When I first saw Jeffrey in the office, he was having many neurologic complaints that were rather subtle and to some people maybe insignificant. However, after spending a few minutes in the office with him and doing a physical exam, it became very apparent to me that he was suffering from a condition called cervical stenosis, or compression of the spinal cord in his neck.
And within, I would say, 10 seconds, Dr. Veyna pointed at the screen and said, well, there's your problem. And I want to say within a week or two, I was in surgery.
What we ended up doing for Jeffrey was something called a cervical laminoplasty. A lot of surgeons might treat Jeffrey's problem with a fusion operation of putting screws and rods or metal plates into the neck. But for Jeffrey's problem, that's really unnecessary. He just needed space. So what we did for him is we went through the back of his neck and we opened up the back part of the spine, the bone, and basically just expanded open the spinal canal to give the room for the spinal cord that it needed.
And was able to alleviate the constriction around the spinal cord, and has now allowed me no pain through my shoulders, neck, arms, and has given me the use of my arms back on a normal, I guess, everyday level.
The benefits of this practice is that we're a multi-specialty group. I have the ability to be able to conference with a surgeon about a case immediately. For Jeff, that meant he could see a surgeon that I was extremely familiar with, and that he can continue care with me post-operatively.
I had seen different neurosurgeons that had just pretty much brushed me out the door. And I felt that if they had listened, as Dr. Farhat did, there would have been years of unnecessary suffering that I would no longer have had to put up with. Well, since the surgery, the successful surgery that Dr. Veyna performed on me, I've lost a considerable amount of weight, over 100 pounds, and currently I'm off insulin, and I'm exercising somewhat and able to live a much fuller life.